Continuing with the travel news,
Yes.
MPs have called for PCR tests to be scrapped for the fully vaccinated after official data showed just 4 in 1,000 bring COVID back to the UK.
Only 0.4% of double-jab Brits returning from abroad at the end of July had contracted the virus. This left travellers furious after prices for PCR tests rocketed, deterring thousands of travellers from jetting off this summer.
We're joined by political commentator and journalist Bill Bowkett. Bill, some MPs are calling to scrap PCR tests for the double-jabbed. Is that right?
Yes, they are. Hugh Merriman, the chairman of the Transport Select Committee, is calling for PCR tests to be reduced, as also is the Health Secretary, Sajid Javid, for numerous multiple reasons. Because for Hugh Merriman, for instance, he says that the reason why PCR tests in particular are so ludicrously expensive is because of the 20% value-added tax that is put on PCR tests, whereas Sajid Javid kind of went on a roar against rogue providers who are overcharging customers for PCR tests, some as much as £500 for one PCR test to travel abroad.
Why are they so expensive? What's the justification? Is it just quite blatantly a racket?
Yeah, there's a number of reasons. The first being the providers themselves say it's the staffing and laboratory fees. Obviously, there's been a high demand for people buying PCR tests in the month of August, and since May, providers have made over £500 million in the funds made from it. But the other reasons, as I just mentioned, are providers that are overcharging customers, and Sajid Javid called in the competition watchdog to get a rapid review on this issue. And then the other thing that I said, and I hinted it in my CapEx piece that I wrote yesterday, is VAT. Firms calling for not the charge to be scrapped, as well as MPs such as Hugh Merriman, as I mentioned, and also the Liberal Democrats.
Bill, it could be argued that we've gone test crazy, and obviously as we increase the number of tests, the number of cases goes up, and we're stuck in this vicious cycle of locking down because cases rise and tests go up in return. Not to disconsider the false positives as well in this argument.
That is very true. I mean, Heathrow Airport, for instance, have said that because PCRs are deterring holiday goers from going abroad, there was a good survey in opinion that showed just that they actually think that they should follow the model of the United States and not just use PCR tests, but use lateral flow tests instead. They're much cheaper, and they also bring back a faster result. But I do understand that there are arguments about scrapping tests completely, particularly for vaccinated individuals as well.
I wonder if one possible solution would be if the government was to cover the cost, then I'm pretty sure they'd find a quicker and cheaper way of providing the test. As you say, lateral flow is perfectly fine, I'm sure. What do you think? Do you think the government's likely to stump up for it?
Well, for months now, providers have been calling for VAT, as I mentioned, to be scrapped. And if it would mean for a family of four, for instance, savings of between £40 and £240, which is a massive amount, and it would easily cover for instance, their return flights home back to the UK. There have also been calls for the government to pay for these tests, and there were encouraging signs when the government last week said that they were going to cut the cost of NHS tests. But I was just curious as to see why they didn't cut it for private tests, which have been since January mandatory for flying abroad. So there are a couple of alternatives and options that the government could have into this. And there's been multiple promises, like from Grant Shapps, the Transport Secretary, saying that they're going to look into the issue. But as is in your previous segment, we're coming, to the end of the holiday season when it will start to die down, and especially that's disconcerting to the grounded the aviation industry who have suffered so much during the pandemic.
Bill, have there been questions raised about the quality of these tests? Because we've seen photographs and footage on social media of people sat in China on the floor putting these tests together in a very unsterile environment.
Yeah, there have. And the other problem as well, as I mentioned, with lateral flow tests, if it were to be done under the NHS system, for instance, they could be easily frauded. So they have been put into question into the validity of tests as well.